Now's a good time to thank our sponsor, Survivors for Solutions. There's a lot of great things about this relationship. Like us, Survivors for Solutions wants to see continued innovation in the pharmaceutical space. They embrace the free market and believe that the free market is the best solution to improve patient lives. It was founded by our close friend CZ, or John Swartacki. CZ founded the group when he saw the damage that the Inflation Reduction Act was going to bring to the pharmaceutical ecosystem. He's been a patient, and Eric, I think you'll talk about that in a minute, but he's been a patient for several decades himself, and he wants solutions not just for himself, but for his family and friends and for Americans in the future. And he knows how important it is for continued pharmaceutical innovation to happen here in the United States, because if it doesn't, it won't happen anywhere.
Joe, you're right. CZ is a longtime friend of both of ours and a seasoned Washington pro. But what most people don't know is that John Swartacki has also suffered from multiple sclerosis for over 30 years. He was diagnosed and has required 4 different breakthrough drugs over the course of this disease in order to just live. All these drugs have been developed in a robust ecosystem of medical discovery and delivery, an ecosystem that the Inflation Reduction Act and President Biden now threaten. That threatens the hope and security and safety, the liberty, and ultimately the lives of millions of Americans suffering from chronic, debilitating, or life-threatening disease. He formed Survivors for Solutions to help save this system so others like himself have the chance at a fulfilling and robust life. You can learn more about CZ and his lifelong struggle with multiple sclerosis from our March 27th DC EKG interview, plus his website, survivorsforsolutions.org, or on Twitter @HopeMattersMost. Joe, we're really fortunate. CZ is our leader here at DC EKG, and we look forward to advocating on his behalf and the behalf of millions of American patients in the years to come on our show. Welcome back to DC EKG. I'm Eric Euland, along with host Joe Grogan, and our great guest, David Senior, for this segment. We've been talking with David today, who works at AmerisourceBergen for over 20 years, about a variety of healthcare and pharmaceutical issues, pretty significant as a matter of fact. But David, one of the things that lots of people have in their head, I'm sure you've run across over your years working at AmerisourceBergen, is a lot of misconceptions about the market. We've talked a little bit about how it really works, access, pricing. Talk a little bit, if you can, about some of the most common misconceptions you run across and how you explain what the facts really are about some of these most repeated challenges that you run into about people who just don't really get, as well as they could, how everything really works.
Yeah, thanks, Eric. It's nice to be back. I think the biggest thing that I step back and say is that healthcare is different than other industries. It just fundamentally is in so many different ways, and healthcare economics is different. Whether the product works or the service works the way it's supposed to. Certainly, who's paying for it? It's emotional because it's our health. There's so many things that are different, and what's interesting is that the pharmaceutical industry is probably the most visible in terms of what patients see, because people go to the pharmacy. If you're on a chronic medication, you go to the pharmacy every month. You start in January and you're there every month. There are some other parts of healthcare don't work that way, where patients are seeing that, and so this whole idea about price and cost get conflated, and I think that people see that they get confused by it. The fact of the matter is, many products in a business to business world have a gross and net. I think most of your listeners probably understand the concept of gross to net. This isn't the only industry. College tuition has gross to net. Many things do, but patients face this, and so it gets very frustrating and complicated when that takes place. And what's particularly been historically complicated for patients is that the out-of-pocket costs, whether it's deductibles, copays, are tied to that, oftentimes tied to that list price. And so that creates a lot of complication in terms of and frustration for patients, which is, well, what does that really look like? So when you get a bill from a hospital and it's 100 pages long and $1 million, but at the bottom line it says it's $1,000 been negotiated, that's sort of all the patient sometimes has to worry about. The drugs just don't work that way. And so the fact that there are very complicated pricing models, whether it's the model that we operate in or others, and it is complicated. I don't know if opaque is the right term, but complicated in terms of we're selling branded products, generic products, biosimilars, and they all have their own economics behind them. But we sort of lump bundle those together oftentimes into a relationship with a customer, and they're all different. But this idea of the complexity is something that people see a lot closer in pharmaceuticals than others, and we all have to when I have to answer the questions at the Thanksgiving dinner, it's about obviously, to your point, drug prices, and it's people see it and it's in the news, and as much as the pharmaceutical industry did a wonderful job at its best during the pandemic, whether it was inventing therapies and vaccines, or frankly the supply chain performed very well in the pharmaceutical space. The fact of the matter is, the public, continues to be a little frustrated with drug prices, and it is what it is. And I think it's this aspect of it's so visible to us every month when we're paying the bills that this is a complex transaction.
David, let's talk a little bit about another aspect of a subset on drug pricing issues, which is biosimilars. The biosimilars market was created with the passage of the Affordable Care Act during President Obama's presidency. Really, they were always viewed differently by scientists because they were actually biologics. They came out of California. Amgen, Genentech created this industry, and then it sort of blossomed. And originally, there was not a generic pathway as there is for small molecule drugs. And then the biosimilars market gets created by the Affordable Care Act. The market seemed to have taken a while to take shape, and there was a lot of frustration that the promise of declining prices was not being realized. But now, recently, we are seeing more biosimilars come on the market. Humira from AbbVie has competition for the first time throughout its entire since its invention. Can you talk about the evolution of that market and the promise of declining prices in biosimilars? And are you worried about price collapse as we've seen in the small molecule market, the true generic market, that have led to shortages, or is that not something to worry about?
Yeah, it is exciting time in that market. To your point, Joe, it did start slowly, and I've said, and people probably just ignore this comment, the generics market started in 1960, and in the early 1980s, Hatch-Waxman came along, and that really sort of opened up the market, and then 20 years later, it was continuing to open. People thought this was going to turn on overnight, and to your point, Joe, I mean, it was fascinating to see the frustration with, in the first 3 years, it didn't, open up the way that it could. I mean, think about, where we are today, and, I'm going to quote some IQVIA data that might be a little bit outdated, but probably close enough. Out of a, $260 billion, biologics market, 38 billion of that is facing, biosimilar competition today. We do see significant deflation, as you're mentioning. And as IQVIA has pointed out, of that 260, another 90 billion is expected to go have biosimilar competition within the next 5 or 6 years. And that includes Humira, which is probably close to 20 billion of that. So it's coming. It's an exciting time in terms of the opportunity in terms of that marketplace opening. And I think from the standpoint of the savings that biosimilars are generating, they are substantial. And so we should all be excited about it. But to your point, Joe, it has risks as well. And what we've seen thus far is number one, and this isn't necessarily a bad thing. It is what it is. The originators, maintaining market share longer than we generally saw in the biosimilars. We saw less deflation initially, but over time we are seeing deflation in the going from 30% to 40, 50, 60%, and with Humira we're seeing even deeper discounts. So it's too early to say, Joe. I think whether we've got a problem on our hands. It's Humira. I've kind of said all along, Humira is kind of a unique situation. It's so much larger than the others, in terms of the size, and hence we've got I think at least 10 competitors coming in and competing for that market. We don't see 10 in other biosimilar spaces. We see a handful, and that's we should speak to a more realistic and sustainable marketplace. But this idea of a sustainable marketplace is something we've got to all be working towards, whether it's the market or policymakers, to ensure that those savings are realized. And it's the best example of savings that this country has in terms of opportunity for savings. Can come from biosimilars, and so we should be doing everything we can to foster, a healthy marketplace in this arena. And the branded manufacturers will continue to innovate and come up with new products, and that's sort of the way things should work. So, Joe, I think we're seeing it coming about. I mean, I think everyone's wishes this were happening faster. Wishes that the opportunity was clearer for the biosimilars manufacturers, but we're still quite bullish about what's going to take place. And sort of going back to a topic we had covered in a previous discussion, Inflation Reduction Act creates some uncertainty as well for the manufacturers, because now they're facing competition with the originator, who is also subject to inflation, Medicare negotiation on their products. So it creates a bit of uncertainty in terms of what that price point is. But I think it's too early to say, Joe, that we're going to see the same price crashes, and therefore manufacturers are going to say we're not going to participate here. But it's something that we're certainly watching.
David, Joe, when you mentioned Hatch-Waxman and then biosimilars, people saw the promise of that years before statute was actually enacted and regulations started and the marketplace took off. Is there anything now similar to that people should be thinking about, policymakers should be focused on, that might be the next set of emerging public policies in healthcare and pharmaceutical area?
Well, one thing, I mean, the big issue would be cell and gene. I mean, how do we get these scientific breakthroughs for small populations that are really expensive? Sarepta has a new product for our Duchenne's, which is a form of muscular dystrophy. It's a very difficult disease, and it's priced well into the millions of dollars. So I don't know, David, if you want to talk about that. I mean, the science is going to evolve. And policymakers need to figure out how we're going to deal with this and lubricate that market so that patients can get it. But I don't know how Amerisource is viewing the marketplace evolving, and if you've done any thinking there.
Yes, we have, Joe, and I think that I sort of think about the evolution of the pharmaceutical space in five waves that we've lived through: the branded market, the generics market, specialty, biosimilars, and now cell and gene. And in each one of those, they have their own dynamics and economics and growth. And it's interesting that we've got multiple sort of entire categories that continue to grow, and cell and gene is the next one, and it's upon us. And our role at AmerisourceBergen, playing a role of both a distributor but also a financer of the channel. Effectively, we're playing that role between the financing of the working capital within the channel. We've thought about how could we play a role, how could this take off, and to your point, cell and gene has its own economic challenges. If you think about a patient who is on chronic care medication that could be in the tens of thousands of dollars, but to your point, Joe, some sort of multi-million-dollar treatment comes forward. How do we? Who pays for that? How does that decision get made? And given that there's people, there's portability issues that come into play if you're an employee at a private company. The employer has got to face, well, okay, you're working for us today. Are you going to be here 5 years from now, 10 years from now? The insurance company, the reinsurance company, sort of who's going to sort of solve that? It hasn't been as big of an issue from the research we've done. Access in the commercial market has been pretty good to date, but we are concerned that as more and more of these products come forward, that more and more constraints are going to be put in place around that. And we've been big believers in. I talked previously about healthcare economics and what's different, and we've sort of embraced the idea that cell and gene therapy, one-time treatments, curable treatments, are more applicable for outcomes-based agreements. So, did it work? Did it not work? Did it work over a period of time, i.e., not just 1 year, but multiple years? And can you prove that? And can the payment be, in some way, shape, or form linked to that performance of the product? And so, we've been big believers of that. We've been working towards, our solutions. We think others are too, around, how do you play a role, between, providers, insurers, manufacturers, to build out these types of agreements. And, they're hard. They're hard to build out the metrics for, what's going to be measured, what constitutes success, what constitutes, lack of success. And then the tracking. How do you get access to the clinical data? How do you track the patient? How do you stay in touch with the physicians who are involved in the care? So it's a complicated thing to solve, but we think it's one worth solving. And we were actually intrigued, and I haven't really followed where it's gone, but one of the recommendations from HHS in response to executive order earlier this year was for the states to band together for developing outcomes-based agreements for Medicaid. And it's an intriguing idea, and Medicaid is one of the areas where in talking to clinicians, where the barriers to care are higher than even in the commercial market. So we do think that of all of healthcare, because of the cost of these treatments and who's going to pay for it, we are going to have to come up with some new solutions around how it's financed, especially as this grows. And we are very bullish in the coming years about the number of products that are going to be coming to market, and how prevalent this is going to be. Very excited about the science.
Thanks. I appreciate that. Joe?
Well, David, this has been a great conversation. I want to thank you for coming. Every time over the years when I've had the opportunity to ask you questions, I always learn things. I know Eric's learned some stuff here today too. I know I have. Thank you for your time. And what's AmerisourceBergen's name going to be in the coming months?
Cencora.
All right. Well, we'll look for the new name and the new ticker symbol. But on behalf of Eric Ulan and myself and DC EKG Bigwig Media, thanks very much.